they don't you can't really move them very easy. They're gonna yank on you and all that stuff. So the reason it's hard is because they're so tiny and they move all over the place. So, oh, you're just gonna keep doing that, aren't you?
Yeah.
You can have it back. I don't mind. So you're gonna just do your best to keep their hands open. I just kind of put one thumb in there and then just work with whatever I'm going to, or you can use your other finger. It's because you have something to say.
Yeah.
It's because you have something to say. I know. And you don't like being out. You don't like being out. Alright, so these are all going to be real repetitive and real quick. Most of them are going to be on the hands. So this particular protocol, you start with the thumb. So you're going to hold this little thumb like this, and you're going to do this motion 50 to 100 times. It's going to be fast. So you're going like this.
Okay.
And it's mild. It's not painful. You don't have to put your fingernail in it.
Right.
And if he moves or gets out of your grasp in the meantime, it's okay. You can just go right back to doing it. He's actually not bad at this. And you're going to do it both sides as soon as you're done with that. And I don't count exactly. I just kind of do as much as he's going to tolerate. and that's pretty much how it's going to go the whole time. It's a little bit easier when you can get a grip on them like this.
So it's kind of along the side of the thumb, here going down the
Yes, you got it, exactly.
Okay.
You're not taking this too hard, little man. It's all good. And so this is going to be a lot of the motion. It's going to be from the fingertip inward. That's the deficiency patterns. Excess ones, we would go in the opposite direction.
Right.
It's got the cold hands.
Right.
We assume it's the deficiency pattern. The next thing is we're going to knead the center of the hand. And kneading, with little ones, is really just going to be like this.
Okay.
It's kind of easy to do. They will grab your finger like that. So this is the very center of the hand.
Okay.
And kneading.
So the center of the back of the hand.
And it's the same type of thing as much as they tolerate. This one usually isn't irritating to them like the other ones, so they go for it for a little longer. Yeah,
so are you just kind of trying to rub in between the two bones there, or are you sort of rubbing in a circle?
It's right in the center, and it's right in between the bones.
Okay.
And you're not super hard, but you definitely want it to stimulate the area, so it's good to do it moderately. And this side, I just grab it the opposite direction and try to hold on. And you can use your fingers too for this. It's okay if you can't get your thumb on here. Got a good grip, little man.
Yes, he does like to grip on the things that help, especially when he's not swaddled. It helps him calm down.
It's good for doing this, that's for sure. Then you're going to move on and do the same thing, except for in the wrist crease instead of the hand.
Okay.
So it's just, I use my middle finger to kind of brace their little hand, and then just use your other hand gently, obviously. If they move with them.
Right.
Same type of thing. It's like a kneading.
And it's just going in between the two bones.
I always kind of go a little bit on clockwise side because that's stimulating the digestive tract and nourishing the chi. So a lot of clockwise. Oh, I know. We'll be done soon. I promise. I promise. Yeah, watch me do two things at once. That's right.
So in general, with any of the kneading, going clockwise?
Yeah, for him in particular, because it's going to be nourishing the chi, aiding the digestive system. He's still looking at your hand. What's going on here? I see all these hand creases and stuff. It's good. Good deal.
Hi, kiddo. Hi, kiddo.
Yeah. The next thing is a little irritating to them, but it doesn't hurt. It's just a little irritating. This is nip and knees. So you're actually going to pinch 3 times at the inner eminence, and then do this about 50 times right on that. And this is a very tender spot, so you don't have to move as aggressively with it. This is also really good for cough. So this particular point, this is lung 10, which is a great point for cough. Even on adults, if you want to press on it pretty hard, then it can stop coughing immediately too, which is nice.
So that one, I notice you're moving outward. I know before you were saying with most of them you'd be moving inward, but that one you go out.
Yep.
Okay.
It actually doesn't matter. Out or inward for this one is fine. It's a lung channel. Let me have that. Almost done with this one. I know this one isn't as much fun. It's like, that is not producing blood, honey. What are you thinking?
Yeah. Yeah. That's how I can tell that he definitely wants the food rather than the pacifiers when he sucks on the pacifier for a minute and then spits it out. Yeah.
This next one is at the knuckles, and it's kind of the same thing that we just did with the nipping and kneading. I do all of them first with the nipping and then knead them all. So it's like the center knuckle right here, and so you're just real gentle. This is not anything that you need to do hard. It doesn't really matter the order either, just whatever I can grab and get a hold of. And then you're going to take each one individually and just do that same kneading motion as many times as he's going to tolerate, which this one is not as much fun, so he's not going to really want to feel this for too long. You can do this while nursing too. He'll get good at it, and you'll just use one hand, and because he'll be distracted, he won't move as much.
Yeah.
That's usually how I do that. With my kids, just... I know, we're almost done. Alright, next one is a little tricky, but we can still do it. The books are so funny with their language. From the wrist to the elbow, 100 to 300 times. You're going to take... I usually use the tip of my 2 fingers with babies this little. Eventually, I use my whole hand and just use all 4 fingers. But from the wrist to the elbow, you're going to do the same thing. And you're just going to rub. Yes, I know it's not fun.
And so are you just kind of rubbing all around, or?
Nope, right on the side.
The side, okay.
Yep, it'll make it a little red because I'm doing it over in the same spot over and over again. He will start to get used to this, and then he'll actually probably fall asleep while you do it too. It's irritating at first, but they start to like it at about 2 months old.
Right.
So if you won't need to use it that long. He'll be over all this stuff by then. It usually works within a couple of times.
Yeah.
Like if you do it once a day, and usually within 2 or 3 days, it starts to really take an effect.
Okay.
So since I'm seeming to make it pretty well through this, you probably won't have to do it again until tomorrow. No deal, guy. He's like, fine. You have to. It's going to be harder with this one. Actually, maybe not. You're doing a good job, right? 2 more after this. And they're not the hands. You'll be happier. Use his squishy ears.
Yes. Does he still have the little elf point on that one? I can't tell from this angle. Yeah. He likes to put his head on that side more than the other side, so the ears remain creased on that side.
You're doing such a good job. All right, so the next one is my favorite. This is going to actually be counterclockwise. And this is because this is use gas. And this is called the Bagua. But you're going to use just the pads of your fingers. And this is by itself really good. And they don't know that they like it yet until it relieves things. So at first, they get fussy, they get agitated because it's pushing on all those spots that are tender. And then gas usually comes out.
And then they feel better and they like it better.
So they learn to like this. This is the part that my son won't let me stop doing. He's 3 and he makes me do this to him all the time. Just like
So why counter? I'd heard before that you wanted to go clockwise on the belly because that was the direction of the digestive tract. So why counterclockwise?
In particular has an upward moving, like reflex oriented. So if the chi is moving up and you don't want it to go up, you really want to move it directly back down. So if you had diarrhea, we would do clockwise.
Oh, okay.
Because he has something that's moving upward, we want to move it down, so we do counterclockwise. So in Chinese medicine, when you want to nourish stuff or move it up, it's clockwise, and when you want to remove things, remove them down, it's counterclockwise. Same thing with constipation.
Right.
Like, so if he was having trouble going to the bathroom, we do the same thing, counterclockwise. You're almost done. There's one more thing.
And what about with the lower belly gas that he gets? Like will the counterclockwise help with that as well? Okay.
Absolutely. And then another thing you can kind of add into it is you can do the rib cages, which you're going to like start from just the lower rib cages, and you actually you can use one hand to do it with him, and you move all the way down into the hips.
Okay.
You can do that like 50 times.
Okay.
A lot of times too with babies, you can put my fingers are touching in the back, and you can use your thumbs and do the same thing.
Okay.
These are good by itself too. Like this particular stuff you can do by itself without the rest of the protocol. Same with that. The last thing on this one is stomach 36, which is an acupuncture point. In an adult, I would usually take 4 fingers and find it like this, but in a baby, I just take my thumb from the kneecap, and it's going to be just lateral or outside of this bone here. And you're going to just take your thumb, and you're going to put moderate pressure, the same as the rest, and you're going to knead this.
So it's a thumb's width below the kneecap to the side of the bone.
Yeah. Okay. And I'm trying to just knead this neutrally, but if it's more comfortable to do a clockwise pattern, that's okay. This one's a nourishing point. I'm going to do both at the same time, actually. The acupressure portions of it you can do a lot easier both at once. You don't mind that one, huh? It's actually a very tender spot. Like if you press it on yourself, you'd jump.
Yeah.
So, but babies, they're always almost always deficient in some kind of digestive or chi. So it's usually not as like excess, and then they don't feel as much tenderness there. It's also a really good immune system point. So we actually recommend that parents do this particular one with their babies all the time anyway, even if there's nothing wrong. Same with the stomach one.
Okay.
And if there's nothing wrong with their stomach, you just alternate between clockwise and counterclockwise. It makes it neutral. So you do like 50 one way and 50 the other way. We like that. He's like, okay, can you now? All right. You are all done. With everything I do, I always do this at the end.
So what do you just...
We're pulling
the
junk
feet,
out of the feet. So just because if we moved anything downward, I want it out. So
right.
The feet hold toxins in them, and this does not hurt them. You can be rough with the feet. Not like overly rough, but... You like foot rubs? Good deal. All right, you are all done. Now you can have food.
He's like, yay!
Like,